Hi, everybody. Good to be back with you. I hope everybody's doing great. Hope all your puppies and kitties are doing great. This is podcast number 2 with Low Cost Pet Vax. I have the amazing and esteemed Dr. Joseph Camacho with me. He's one of the new superstars here at the Urban Clinic. From San Antonio, went to school at Arizona. It gets hot there. Anyway, I'm Dr. Rod Munsell, Dr. Joseph Camacho, and we are going to be talking about heartworms. Heartworms.
They're everywhere.
Would you agree with this, Dr. Camacho? Heartworms are by far the most devastating parasite that dogs get.
I would agree with that. Just because when you do get infected, then the treatment is so much more harsh on them. Mm-hmm. Compared to like if they had a flea infestation versus they had a GI parasite where you just give dewormer or put them on flea intake prevention, you take care of that. Versus here, if they are infected, it involves not just a one-time treatment, but several months of treatment, and it can be, really hard on dogs with that as well. So I would agree with that. And on top of that, the sequela of what could happen with the heart as well after treatment during the infestation and infection of heartworms as well. Mm-hmm. Mm-hmm.
And even after treatment, we're usually fairly successful with it, but they can be infected again, or infested. Do you say infected or infested?
Infected. You can be infected again.
Parasites.
Yeah.
Okay.
Yeah. With
anyway.
parasites. Yeah. Exactly. Yeah. Mm-hmm.
Tell us a little bit about just our average client. Heartworms. One of the devastating things about them is they are so you can't see them, and you can't tell that your puppy's having any problems until it's just about too late. But anyway.
Yeah. I think that's the thing, right? Because one, they're transmitted through mosquitoes. So it just takes one mosquito that has the parasite in it. But unlike tapeworms or, roundworms where, usually puppies either poop them out and you can see them.
Right.
Heartworms are kind of like a silent deadly disease that, like you mentioned, the clinical signs or symptoms for, people out there. Once you start seeing symptoms, it's usually already a pretty advanced disease.
Gotcha.
Versus like sometimes they don't even have clinical signs or signs at all. And sometimes the signs that they do have are very ambiguous. They can present and come here for other symptoms that you might not associate necessarily with heartworms. I had a case like that recently, actually. And so it just takes one mosquito, and then that one mosquito infects them, and they start multiplying in the circulatory system, in the veins, and then eventually they inhabit in the heart. That's why they get, their name, heartworms, in the right side of the heart, more specifically. And they just keep multiplying. And I think we do at least a good job, of starting very early with heartworm prevention with puppies, because what people don't understand is the life cycle of a heartworm is about 6 months before we can actually start seeing positive tests. Yeah. So if the puppy was infected with the heartworms or was bit by a mosquito, let's say 8 weeks or something like that, it's not going to be until like they're 7-8 months old that we can actually start potentially seeing a positive heartworm test, if we even get a positive heartworm test. So it's very important I know they're inside and they're small, they don't go outside, but to keep them on heart prevention from an early stage as well. Mm-hmm.
Are there any months that you would, I know you spend a lot of time in San Antonio, where it's kind of dry. I don't think there's a single mosquito in Arizona though, right?
There is mosquitoes, but very far and sparse. I think they get burnt by the sun. There's different issues, but we rarely see heartworms in Arizona. Yeah, it's other things. Mm-hmm.
But obviously, we're not in Arizona now. So
no.
Are there any months just, if you, as you're advising clients, would you, if some would say, well, they're transmitted by mosquitoes, maybe during the winter, heartworm preventative is not that important. What would be your answer to that?
It's so important because what heartworm prevention does is kills off the baby or the microfilaria stage of the heartworm cycle.
Right.
And so we can prevent from those then becoming, adults recurrent basis. But what I'm seeing is they get infected in the summer, and now we're seeing the positive heartworm test because it takes 6 months roughly. We're right around that age. So
Right.
the other doctors have seen a lot of heartworm positive tests here as well recently. I myself as well. And so it's just very important to keep them on heartworm prevention year round because of that 6 month life cycle. But also, you don't know if we're doing pills specifically. I'm more of a fan of the injections because you don't know if there was a lapse in heartworm prevention. But I understand people's budgets, I understand people's lifestyles, so
Sure.
There's a variety of preventions out there. But that's the reason why we say keep them on heartworm prevention year round, because the prevention is not going to get rid of the adult heartworms. That's why we have to do treatment for the adult heartworms
Right.
if we're preventing them from getting to that stage of the life cycle.
Gotcha. So the risks go down in the winter, but they never get to zero.
No,
So
no.
any mosquito could be a heat-seeking deadly missile.
Yeah.
And if we have a warm-up day, which
Exactly.
we do in Texas.
Yeah, exactly. Mhm.
I've seen a lot of Christmases that wear, short-sleeve weather.
Or if you have a very wet Christmas, or
Right.
yeah, exactly. It's never zero. I wish I could tell you it's zero, but no, yeah.
It's kind of interesting from an old guy.
What?
Back in the day, we rode dinosaurs to school and stuff. But I think from, the numbers that we have, the incidence of dogs that are positive, I think it's basically the same as what it was, 40, 30 years ago. And and that doesn't make sense because we have such effective preventions. Why would you say that we haven't put a dent in how the percentage of dogs that are actually infected?
Well, I think you kind of already alluded to this or mentioned this a little bit earlier, but they can get reinfected. So let's say they do come to our clinic and they're positive, they go to the treatment regimen. I think a lot of people have the misconception that once they're treated, they'll never get it again.
Sure.
But if we get treatment, let's say yesterday, we got our last shot, of the treatment,
Sure.
and then you don't put them on heartworm prevention afterwards. Literally the next day, they can be bit by a mosquito, and then we go on and go on. And so there's a lot of, one, reinfections as well, and then two, I think that's the main one, the reinfected, but a lot of people don't realize until it's too late. So they've never been on heartworm prevention for a very long time, or they don't think it's necessary. Cost, maybe. We're trying to obviously mitigate that through our clinics, the cost of heartworm prevention and treatment. But I think the main one is I think people don't know that you can get reinfected. And
Gotcha.
you have to. Treatment just kills the ones that we have at the moment of treatment, but then they can get reinfected again. Mosquitoes are never going to go anywhere.
Gotcha. And I think I was, talking with our guys that, keep all the numbers. I think it's like 1 in 20 dogs that we test at the vaccination clinics. And we probably test, I'm going to say, more than anybody in the state.
It's a lot. Yeah.
We just, between Dallas, Fort Worth, San Antonio, Houston, Austin.
Yeah.
About 1 in 20 dogs are positive. And those are just the ones that we test.
Yeah.
And certainly some that we test, and we'll get to this about the why we test. And we really want to cover why, a lot of clients, wonder, I just want to prevent it. Why should I test? So we'll go over that. But I would suggest, again, being an old guy, and is probably the biggest reason why we haven't made a dent in it is because when we have such better preventatives than we used to. We used to have back in the day, one you had to give every single day.
Yikes.
And and it wasn't super safe, but you had to give it, anyway, we've gotten way much better.
It's a lot better.
The biggest problem is what they call compliance.
Combines, yeah.
And, and like they say, if you're like me, and I know I am, that, the biggest problem is people forget.
That's what yeah.
They get caught
Yeah.
with life. They're busy, and remembering to give something once a month is just easy to forget.
Yeah.
And
even bills, even the bills. But it's fun. It's funny because we're both vets, right? And I'm also in the camp of I'm gonna forget to do monthly pills, and I know the importance of heartworm prevention. So that's why I'm a huge fan of the injectables.
Yeah.
Just because
I agree with that.
I myself, being a veterinarian, will forget. I know I'm going to forget. I wish I could be like, no, I have an alarm, and I gave it to it. But also, you have to put into perspective. What if you do give it to the pet and then they go off and spit it out? You don't know.
Or vomit.
Or vomit it a few moments later, but you don't know because they were in the backyard.
Right.
So at least with the injection, you're sure that it got in, and you don't set it and forget it.
Right.
And it's just, but I agree with that sentiment. I too would forget, and I have my dog specifically on the 12-month injection because I was like, no.
I just so agree with that.
Yeah.
I think that is probably one of the biggest takeaways for our clients is how superior a prevention the injectable is. But we'll get to that at some point. Just an interesting thing, talking about how we forget. When I was young guy before I got married, I was behind on every bill I had. I think they probably turned my water off a few times.
Did they really? They're really gracious about
I
that.
would
That was
forget to pay my
months.
bill.
That had been months.
I could pay it. I never meant to not, but I just forget. And
So you just go in when they try to turn on the lights, and you're like,
yeah, time to go pay the bill. But anyway, again, that's just highlighting compliance. People forget, and why have we not made a dent in the percentage of dogs?
Yeah.
I think that's probably, and that's why your point about the injectable is so good. That's, but anyway, heartworms. Go ahead.
I also wanted to add, I think we're starting to see heartworms in places where usually heartworms were not a problem because people move, and so usually it's something where it's subtropical climates that you see like Texas, Florida, the South essentially.
Right.
But then with the movement of people through state and states, we're seeing heartworms, in states where they usually don't have a problem with that. Arizona was not a huge problem, but if we do see a heartworm case, usually it's because it was a dog that was transferred from another shelter from another state, or somebody moved from a state that had heartworms or is prone to heartworms. So that's another reason where, one, we haven't made a dent, but also we're seeing a spread as well across the nation because more of the movement of pets. Yeah. What were you saying?
Oh, just, there's so many things, and I start to think of something, and I get distracted.
Sorry.
No. To your point about people moving, especially in these days when we're probably going to get hit with an influx of people from New York, maybe. But they probably don't. Heartworms probably,
exactly.
They have to have it there, but I don't think they are as aware of it. And probably people that have come from a place where it's not that much of a concern, not on their mind, and then they come to Texas and
that's a good point. Yeah,
they leave the dog without starting
prevention
for 3 months, and it's positive. And you've said that the preventions don't kill the adults.
Correct. Yeah.
There's and again, I'll ask you to remember because I'll forget again. But we'll talk about how far back, if you mentioned the life cycle is about 6 months from the time bitten by a mosquito and infected with a baby that's going to grow to be an adult.
Male, female.
6, 7, 8 months, whatever. And I think I was, when I was in school, was taught these things live in a dog, if they're not treated, for about 5-6 years. That's a long time.
That's a long time.
Especially if they're getting infected with more and more and more. You know, I mean, some dogs that, you know, I haven't seen, well, I haven't been around too much. Have you seen, you know, what they call the cable syndrome, where the dog's belly is full of fluid because the heart just is so flooded with heartworms?
Not here.
Not here.
I saw them in San Antonio, though. In San Antonio, I would see them a lot. Not here as much. Couldn't tell you the reasoning why. I haven't seen that yet, but I did see it in San Antonio, where it was cable syndrome, congestive heart failure due to heartworms, right-sided congestive heart failure due to the heartworms, and that's how far it can. That's how severe it can get. Like your dog could eventually potentially die if it's left untreated, not put on preventions, because it does lead to heart failure. Yeah, the case that I had though, the dog came in just for lethargy. It had for about 4 months. Just not wanting to eat. It was anorexic. It was losing weight for about 4 months. So we just did like a blood work, GI panel, wanted to do a fecal and urine analysis. That day they didn't have the urine, so they were going to bring it back. Sent it out. It was heartworm positive. And that's something that, me personally, I completely forgot that it could cause lethargy and weight loss. Because usually when we think of like heartworm symptoms, coughing is the main one. Coughing is like the main one where you're like, okay, I'm going to heartworm test this dog, especially if they've not been on prevention. Because this dog has not been on prevention, but it just didn't cross my mind to even, I just put it on there because I'm like, we're in Texas, let's just heartworm test everything, especially if it's not been on prevention. So it was heartworm positive, but then he brought in the urine sample, we ran it, and it had a whole bunch of protein in the urine as well, and some blood and some white blood cells. And so that's another thing that maybe people don't get. Yes, it's in the heart, but it also does end up affecting the kidneys as well. If it's severe enough or left untreated, heartworms does end up actually causing inflammation in the kidneys as well. And then you can't take care of that until you take care of the underlying primary cause, which is heartworms. And so that's how severe. It's more of a systemic situation of like, you might think it's just in the heart just because I think the name is a little misleading, where it's like, it's just the heart, but it actually affects more than just the heart, and can lead to heart failure, fluid buildup, and kidney issues as well, permanent kidney issues as well. So that was a really cool case, though. I really liked that case, but I just didn't. Wow, I was like, you learn it in the books and then you see it in person. So I have not seen cable syndrome a lot here, but I have seen that kind of sense where like the kidneys, the heart, but in San Antonio, I think we saw when we worked together several that were at that point. It's too far gone. Yeah.
So again, your point is, just to highlight is, you can't look at a dog and tell.
No.
They can be, and by the time they do have symptoms, obviously this dog was progressed quite a bit, and so that gets back to prevention. Prevention is the name of the game. And in Texas, year-round, because we can have mosquitoes, not as risky, but we can have mosquitoes even in the wintertime. Let's see. Go ahead.
And I usually tell people, I know prevention can seem very expensive, right? But prevention is a lot also cheaper than treatment as well. So if you think prevention is also very expensive, just know that the treatment is also going to be very expensive as well, especially when we start getting to like those medium-sized, larger dogs. That's when it starts getting quite, expensive. And so,
well, now that you bring it up, let's just kind of throw out that number. Probably some clients from, how much is treatment? And I'm going to say we are probably half the price of any other clinic.
Oh yeah, for sure.
I'm pretty sure that's, if any clients out there, check it out, compare prices. I think because we treat more dogs than probably anybody in the state because of our name. We can only have prices. I mean, if you call yourself low cost, you kind of got to be
live up to the name. You got to live up to the name.
You can't be high price if your name is low cost. But we also probably have more experience treating because we just treat so many.
That is true. Because even when I was doing my rotations, where I was in the Fort Worth area, I had a doctor where she's like, "Oh, have you treated heartworms before?" I'm like, "Oh, do I?" Like, there's one thing that I do know for sure, and it's funny in how they're so weary about it because they do not really experience with it. So yeah, that is very true. I would agree with that sentiment of like we are like the back of our hand with heartworm treatments and heartworm prevention.
How many would you say, since you've been here, average a week?
A week? Oof, a lot. Because I think every day we have at least one or two
Every day.
of heartworm treatments. I see it on the schedule. It says heartworm treatment 1, 2, 3. So let's just say 2 on the high end times 5. It's like 10 a week.
10 a week.
10 a week.
That's
easy.
a lot of heartworms.
Easy.
And that's
easy.
just at this one clinic.
Yeah.
So, and again, we would like to try to get it and encourage our clients not to ever go that far. But if you're ever diagnosed with heartworms, and just throw out some numbers. I would say our prices for treatment, other clinics probably run anywhere from probably $1,500 to $2,000.
Easy. I was gonna say yeah. It's a grand easily,
and it can be higher than that.
Yeah. Because some also hospitalized as well. I think.
Yeah, hospitalized, and all that's good. I'm not saying that that money is not well spent, but when our philosophy is to try to keep prices as affordable as possible, and pretty much give clients all the information that they need to make a decision, but also throw in where we think it's important.
Yeah.
And to some degree, a lot of that money from other places are spent on tests. And, like I heard, somebody, in school was talking about, okay, we can, run around this test bush, 10 times and then do this treatment, or we can just not run around it and do this treatment. But it's going to end up being the same treatment. There's only one treatment for heartworms.
There is.
Well, actually, we're going to talk about
the study.
They talk about this slow kill that is not going to be option A. It's never going to be option A, but it is an option. We'll talk about that later. But we probably charge here is what, an average $500.
Yeah.
And that's for the full treatment, you would say, or
I would say for the full treatment, 700. Yeah.
700. So
So that's all 3 injections, including pain medications, anti-inflammatory medications, and some sedation. Yeah. So that includes
turnkey.
Yeah.
And so, if there's anybody with heartworm positives, we do a lot of that. Just let you know we're here. But okay, let's try to get these dogs from having to be treated to prevention. Could you go over, the different kinds of prevention?
Yeah. So, I think, like you said, you're back in the old days.
The old days.
There's a lot of preventions, like a variety of preventions. So there's topical preventions that it's just kind of like stereotypical, like flea and tick preventions, where you just kind of part the hair in the back and then put it on there. And usually those are about a month-to-month basis. Like usually those topicals are only monthly topical medications and preventions. Then we go to the pills, and then the pills. Within the pills, there's also a lot of variety because there's some that just do heartworms and intestinal parasites.
Right.
And then there's some that do a little bit more. So they do heartworms, intestinal parasites, and fleas and ticks. So you get a little bit more coverage there. But those are still usually month-to-month basis as well. And then we have our injectables, which are the one I think the only one in the industry right now is ProHeart 6, ProHeart 12, which ProHeart 6 is in the name, 6-month prevention. And then ProHeart 12-month prevention or year prevention. And so those are kind of the 3 main preventions for heartworms specifically. Fleas and ticks is a little bit different, but kind of the same. But those are the preventions that we offer here. And we have these here as well.
And kind of getting back to one thing that you had pointed out, a great point, that is basically the superiority of a medication, a prevention, that the injectable one is. And I would routinely tell clients, if anybody, you can save a little bit of money if you get the cheapest orals. And they work.
They work. They work.
They work.
It's not like they don't work.
Yeah.
Let's just keep that in mind.
I usually tell clients, especially at the vaccination clinics, is if they do get that, I usually encourage them. I don't tell people to do anything. We don't.
Yeah.
We inform, we encourage, we let clients tell us what they want to do. But I encourage clients, do some research on this ProHeart injectable. If you do some research, just about everybody at some point will switch over to that. And I'm sure somebody has, but I've never seen a client move from the injectable back to the oral. It's just that.
Yeah, and I think and I think I've seen actually the opposite, where they end up being positive, and then they end up just sticking to the injection. They do the treatment and they just stick to the injection just because that's how we got here in the first place, right? Like we either forgot, there was a lapse in time or something, and then they had to go through this excruciating process of, the treatment, coming back, in and out of the vet hospital for about 2 or 3 months. And so I see more pills going to the injection, but I would agree with that as well. Yeah. And, they work. Like it's not like they don't work. The pills don't work. It's just one of those things about you forget. You just forget. Where people.
Everybody forgets.
I forget.
Anytime I'm talking with a client, I'll kind of point out, maybe not you, but everybody else forgets at some point. And it just takes one mosquito.
It just takes one.
But anyway. And I would say, and I'll ask if you agree with this, that the injectable ProHeart is actually safer than any of the other medications.
How so?
Moxidectin it results in the slowest microfilaria kill-off, and that's where the danger is. I mean, anytime you're talking with clients, we talk about it's helpful and sometimes required, a lot of times required, especially with other clinics, to do a heartworm test. And, they ask, why? A test isn't going to help my dog. And that is the biggest reason, is that if you give, especially some of the other types of preventative, to a dog that has heartworms, that a boy heartworm and a girl heartworm get together and they make millions of baby heartworms.
Yeah.
And every preventative, for the most part, you said earlier that all these preventatives kill the larval, the baby heartworms. Yeah. They don't kill the adults, but they kill the larvals. Yeah. And the faster you kill those things off, the harder it is on the body. It causes more of an inflammatory response. Yeah. This other moxidectin is the slowest, kills, and therefore it's actually the safest. So the injectable is the most effective, and we don't need to talk about resistance, but especially in the Mississippi area, Louisiana, Katrina, they're starting to see a little bit of resistance. Some of the others, no resistance to moxidectin yet. I'm sure, and in time there will be, but so the reason why I would say ProHeart is just so good is that it's the most effective. It takes compliance out of clients. Clients don't have to worry. We send an email when it's time to get the next
sure. Reminder.
And then it's the safest, even if a dog had heartworms. Yeah. It's the one that we can give that we're pretty confident.
And you gotta mention it where it's a little bit more expensive, the injection, but not by a whole lot. Right. Not by a whole lot. Like when you compare it to the ones that do a little bit of everything with the fleas and ticks and intestinal parasites, it only comes out to $20, $15 more for the whole year's worth when you buy a whole six pack of pills. No.
Just to go over ProHeart again, the reason why I agree with you so much about it in your statement, it is the superior medication, the best one out there, is It is the most effective, and the reason why it's the most effective is because people can't forget. Because when it's time to redose, we're going to send clients an email. And they can choose not, and then our vaccination clinics are like all over town.
They are.
So they can pop into one of our vaccination clinics, just driving by and say, "Oh, we need to go," and be in and out within 15 minutes. A lot of times. Sometimes in the middle of the summer, some of our places are so busy, but even with those, you're in and out within 30 minutes.
Oh yeah, for sure. Easy.
But and then we talked about it's the safest because it is the slowest microflaria baby heartworm kill off, which all preventatives do. That's why, you know, sometimes if we have a heartworm positive dog, a lot of clinics will say we need to hospitalize it to start the first heartworm preventative, and that's the reason why. Especially if they're given an oral, it'll be a faster kill off. What else do we need to?
Well,
You said the cost, a little bit more, not much?
Yeah.
Okay.
Yeah. And I was just going to say also in regards to, so like we talked about prevention, right? Like preventing it, but then like what does heartworm treatment exactly entails and how long that is. So a month, another month, so about 3 months roughly, that's how long the treatment is, that whole treatment process to get. It's really effective. I think it's like 99.8 or something like that. That they'll clear the adult heartworms, something like that. But let's say your dog is heartworm positive, right? We basically start them on doxycycline for 30 days. And the reason why, I don't know how some genius out there, somebody found out that basically the heartworms have this bacteria called Wolbachia that lives inside of them. And doxycycline. Wolbachia.
Okay.
And you use a doxycycline to kill off that bacteria, and thus making the adult heartworms more susceptible. So when we start doing the adult heartworm injections, which is the actual treatment part, and another phrase that they use is adulticide, because that's the adult heartworms.
So this Wolbachia actually make the heartworms stronger.
It's like a symbiotic relationship, kind of. Yeah.
So you kill those off, and the heartworms are whimpier, easier.
They're whimpier. Yeah.
Cool.
And then
It's kind of odd.
I don't know who found out about that. Then you come back after 30 days of doxycycline, and that's when we start the actual first injection of the heartworm injection. And that's just where I start telling owners, like, we don't have to completely crate rest them, but we need to start restricting a little bit of the activity level. Just because once we start killing these heartworms, they're going to start creating small little clots in the lungs.
Right.
And so that's just part of the treatment. It's not that it's, anything necessarily wrong, but when you start killing these heartworms, they have to go somewhere. And so that's what happens. And so we start restricting, a little bit of the activity level with that first month, with that first injection.
Sure.
We send home meds for pain, because it is.
So if they probably don't need to be chasing squirrels while they're starting this treatment.
Okay. A walk.
No, no squirrels.
Yeah. Leash, walk, do your business.
Gotcha.
Come back in.
What do you do? Okay. I'm sorry to
No, you're fine.
What do you do when somebody just has a crazy Jack Russell that just goes berserk when they come home?
Yeah. In those cases, because we've had cases like that where people are like, I can't keep him crate rested. We send home sedation. So, where they'll be chill. Either have a little, kind of...
A chill pill.
Okay. Not basically zonked out unless they need to be zonked out, because every dog is different, but we send home sedations. And we ask about that when we start that process of, do they need sedation to go home? Because it's really important.
So the biggest deal after they start treatment, the biggest worry is if they hit the gas. If they...
All gas, no brake.
All gas, no brake.
All gas, no brake.
As in... shoot up their blood pressure.
Yeah.
They can't do that.
Yeah, they can't do that because the fear is sudden collapse, and then you're going to have to end up in the emergency room for that. And so we send home pain meds, anti-inflammatories, because as we're starting to kill these heartworms, it's going to create some inflammation in the body. And so we'll send home some anti-inflammatory medications and pain meds as well, plus or minus sedation, depending on the patient. Right. Then after that month, where we're restricting a little bit of activity level, they come back for injections 2 and 3. Now, the important thing about injections 2 and 3 is that they have to be 24 hours apart.
Gotcha.
So if you come in on a Tuesday, then you come back on a Wednesday, for example. You just can't come back on a Friday because we're not here on Saturdays. So those injections are back to back. And this is where it's like really critical.
Gotcha.
And this is the part where we really need to just be crate rested. Like no running, no walking, just literally a short leash,
Gotcha.
do their business and come back in.
Gotcha.
Just because at this point, this is where we're starting to kill off a lot of heartworms, adult heartworms at this point. It's still going to go home with the same medications, anti-inflammatory medications, and pain meds as well. But this is where they need to really reel it in with the activity level. And then this is the final step after, doing the heartworm treatment. And then we don't test them again until about 9 months to a year to see that, they're heartworm negative. And then hopefully we just keep them on a prevention after that.
Sure.
And this is gone are our days of being heartworm positive. We keep them on heartworm prevention. And usually most people are really understanding and keep them on the injections at that point because they don't want to have to this whole ordeal again with their dogs.
It's so convenient. It's so safe. It's just,
yeah.
And we remind people. They don't have to put it on their calendar.
Yeah.
But one thing that I don't know where I heard it, in school, back in the day, but I heard that, and I don't think I've ever taken x-rays after treatment was started, but I think they say if you take x-rays and you said these heartworms start dying off after the last heartworm treatment injectable, like maybe 5 days or so, and when they're actually in the vascular system, in the big blood vessels.
Yeah.
And you said they go to the lungs, so they're on the side of the heart that
gets
shoots blood to the lungs.
Yeah, it gets
And as blood's going there, it's getting smaller and smaller vessels and that's why it clots there. Because I heard that if you take an x-ray, like a month after that last injection, it'll look like there's mothballs all in the lungs.
Pin. Yeah.
It's just bits of these heartworms just die off, and they, like you said, they stick someplace and they cause an inflammatory response. And so, would you say the reason why it's so important to keep a pet, no elevated blood pressure, limited activity, is because basically there's only half of their lungs are working at that point.
Yeah, you're just going to exacerbate, the capacity, and they're just being already kind of overloaded working on this thing, and then you're going to go ahead and, exercise is good, but not when we're already compromised, and, whenever you exercise, you're pushing your body, and so then your body's already being pushed significantly already, trying with this inflammation in dealing with this, and so to your point, like if we hit the gas, there's issues that can arise from that as well, and so that's just our big main concern with that. But for the most part, people understand, the risks, and when we explain it, they're fine. Dogs do fine, patients do fine, but that's just something that you have to communicate the risks, because safer for the patient and just to understand. And then that's, I think also when you have that conversation of the importance of crate rest, that's when usually they come forth with like, okay, then I need sedation for the Jack Russell healer, whatever it is. Those cattle dogs,
communicate how important and how dangerous it is.
Exactly.
That's probably the only time I've ever seen dangerous, consequences after heartworm treatment is a dog that just got to running around in the backyard and like you said, sudden collapse.
That can be scary. Like I can see from the owner's perspective, we're like, just kind of like flatline situation.
Speaking of exercise for all of our clients, I haven't asked permission, but I'll just tell you, Dr. Camacho is probably the best athlete maybe in this whole town. Him and his whole family are like marathon runners.
My brother.
Your father was a long distance runner.
He was. I don't like running though.
Yeah, Joseph loves to swim. That's why he just runs now. So I don't get that one. I don't get that one. But anyway, he is training for a marathon. Just
Oh, they told you?
I hear things. I hear things. I just know things. But I tell you what, you mentioned you had a pretty interesting case. Is that the one you've already mentioned?
Yeah, I mentioned that one. Yeah, that was a really interesting case of heartworms.
Gotcha. Just presented.
Yeah, because
tired,
and
losing weight.
losing weight, anorexia,
But not coughing.
But not coughing. It was not coughing.
And coughing is usually the
main
first symptom.
the main symptom you see. And so usually when the dog is not eating, you think of, I mean, it's very ambiguous. Like I said, the signs could be very specific, like coughing or lethargy or like exercise intolerance when they're running or walking, they can't keep up. That's something you're like, probably.
My dog doesn't run anymore.
Yeah, exactly. But as far as like not eating, being lethargic, and for 4 months, you usually start thinking of other issues. Right. But this was a relatively young dog, it was about 2 years old. Gotcha. And so you start thinking more like GI or something else, but then when that test came back positive, I was like, oh. And then it was confirmed, like, this is definitely heartworms when the urine came back, and there was also urine issues, kidney issues and urine issues as well. And so that was just very, very interesting, because I think when I was in San Antonio, I would just see, like, unfortunately, like, the very severe cases and the worst of the worst. In that clinic and just in general, I would see the worst of the worst. And so this was just like the very beginning stages, and he was just losing a lot of weight. And so he's on currently under the treatment. He's still on the doxycycline, so we'll see him in a month for his first injection. But that was just a very interesting case, just in general. And then one of our surgeons was telling me too that he did some type of surgery where he found a heartworm in a kidney, and I was like, oh. And he's like, yeah, like that's crazy, isn't it? I'm like, that is crazy. Granted, also, if it's super, super, super severe, I don't know many veterinarians that do this, but if the load is so great, they do actually have to go in there and surgically remove the heartworms from the heart. You have to go into the jugular.
Have you ever done that, or
no?
Or been?
No.
In the room once?
No, I wish. That's cool.
Yeah.
I love surgery, but no. I have seen something, a PDA with a cardiologist. That was cool, but not where they have to remove the heartworms from the heart. So, but I have seen heartworms on a echo, and they look.
Oh, okay.
I have seen heartworms inside of a heart. So that's a cool experience. It's just me geeking out, but that was the interesting case. I'm trying to think if there was another case that I had that was interesting. Oh, I do. I have another case. So they found the dog from the streets. Right. And so I'm saying the reason I'm telling you the story is more to put to rest maybe some speculations that ProHeart doesn't work. Just because they found the dog on the street and they took it in and they started on ProHeart. And they did a heart test, it was negative, and they started on ProHeart. And then they came back to our mobile clinics about a year later after the ProHeart 12 injection, and they tested it, and it was positive. And so they're like, oh, that doesn't make sense.
That's a good point.
It doesn't make sense. It was on the ProHeart 12 injection. Why is it positive? It was a negative. And I'm like, and I was just reiterating the story. I'm like, okay, did you guys, you guys grabbed them from the street? And like, yeah, do you guys know any history? No, not whatsoever. I'm like, okay. And this is why it's important also, the 6-month life cycle. Because I told him, well, most likely what has happened here is that he was infected. She was either infected right before you guys came to our clinics or just a few months, just enough time where it was not going to come out positive. So it was not within the 6 month, it was still within the 6 month period, not after the 6 month period. And so they could have been infected right before we started doing the ProHeart 12 injection. And that's one of my patients that I have currently right now, where they're under the heartworm treatment regimen right now. And just explaining a little bit more of that, where it's like, there could be times where your patient or your dog could be negative, right? But it hasn't been on prevention for so long. But the time that you came in, got the test, was within the actual 6 month period. So it's going to be negative. And so that's why it's also kind of important to, if we're not too sure of the history or we've had lapses, get them tested just to make sure, and just be aware that just because there was a negative and then there was a positive does not mean that the medication didn't work. It's just there was probably some type of infection where that first test was not in the appropriate timing of being able to test. So that was a really cool case as well, just having to explain that. And they were very understanding, but just having to explain and walk the client through that.
That could be, kind of hard for a client to understand. And, and the explanation is in the life cycle, right? And where the preventatives actually work.
Exactly.
They don't kill the adults. Matter of fact, most of the orals they'll probably reach back a little bit more than 30 days. I don't want to, encourage anybody to push that. The injectable actually reaches back even a little bit more than that. I don't want to, talk more, but I think, but anyway, just 2 reasons for the test. One, to make sure that it's safe to give, especially the oral heartworm preventer. It's not so important with the injectable because it's so safe. But to make sure that they're not positive and have a bunch of microflaria baby heartworms that it's going to kill off. So that's a safety issue to do the test. It's also important to do the test to find out, do they need treatment?
Exactly.
Are they positive?
Yeah.
And like you were saying, if you test at one point in time and the test picks up only adults, and actually only adult females, right?
I was like females, yeah.
So it only picks up when they're adults, and the preventative works at the just got bit by a mosquito stage, and the 4 months or so in between there is it's invisible. It's a black.
Yeah.
We can't tell. That's why it's important to test a second time, right? After you start.
And the importance of also testing, right? Like, do you imagine these people who did not test again, and they were just on prevention over and over and over and over again, but they would have still potentially could have still led to cable syndrome, heart failure, because there was actual heartworms.
Heartworms live for 5 to 6 years.
Yeah, exactly. So it's important to just know that, we're not infected, we don't have heartworms themselves.
Right.
Just not giving prevention just like that. So yeah, that was just a really interesting case. So those 2 cases were really interesting, and they're both under treatment right now.
Yeah.
And
so the second test is not so much a test to make sure it's safe to give the prevention. It's a test to make sure that they weren't already infected when you started.
Exactly.
Because the test only picks them up at adults. The prevention only works here.
Yeah.
And you've got 4 months that if you started a prevention when the heartworms were 4 months along, they would test negative, and your prevention wouldn't get to them. So they need to be tested a second time.
Okay.
Well, our lady who runs the timer is about to bring out the hook. So we're going to wrap it up. Dr. Camacho, thank you so much.
Anytime. My pleasure.
It's great to have you. Clients, anybody, questions, call. We've got some great people here at Irving, got great people in San Antonio, and the vaccination clinics in Houston as well, and Austin. So we're signing off. That's one more in the can. Low Cost Pet Vax podcast number 2. Have a great day.